Hey guys, it's Dave. Today we're going to talk about something I actually saw on Dr. Pimple Popper and went, that would be a good topic for a YouTube video. I've heard about it several times, and in fact, one of my friends is a wound nurse and she says she sees it a lot. And that is lymphedema, also known as lymphatic obstruction. It's tissue swelling that is caused by the buildup of fluids and protein that is usually removed by the lymphatic system. However, something has gone wrong, and so it's not removed, and instead it builds up. It commonly occurs in the arms and the legs, but you can also see it in the neck, the abdomen area, and in the genital area. It's caused by any issue that blocks the effective operating of the lymphatic system. The lymphatic system actually takes fluids, proteins, and toxins from the cells, removes them from the cells, and takes them and puts them into the bloodstream where they're removed from the body. But something happens where this is obstructed or stopped, and then the fluid builds up and you have edema or swelling in that certain area. For signs and symptoms, what you see, of course, swelling, redness, puffiness, stinging, itching, tightness of the skin, because, hello, you're swelling, as well as heaviness. Your arms, your legs, your feet, they will feel heavy. Then you will see thickening of the skin and hardening of the skin, kind of like turning it into leather or elephant type skin. And you will see weeping a lot, where fluid actually will come through the skin. And that's what happened on the situation with Dr. Pimple Popper, is the fluid was weeping out, causing infections to occur. That is another thing you'll see, is more recurrent skin and soft tissue infections than you would otherwise see. And it's a very important issue to get taken care of if you're a diabetic because of that situation. As far as causes, number one, cancer or cancer treatment can be a cause, especially if you're looking at radiation. If you've had surgery in a certain area, you could be more prone to it. Parasites can cause it. Trauma to an affected area, especially if a lymph node is involved in that trauma, or you could be one of the unlucky very few where it is an inherited condition where you're not born with an actual fully functioning lymphatic system. As far as risk factors, older age is one of them, obesity, a lack of exercise, rheumatoid or psoriatic arthritis. Also, if you have kidney dysfunction or kidney disease, and congestive heart failure, you will be more prone to this. As far as complications that can occur, like I said, an increase in infections. Cellulitis typically is the most commonly seen. Sepsis, which is a serious bloodborne infection that can literally kill you if it's not treated. Leakage that changes the aspect of the skin and the way it looks, the way it feels. Like I said, you'll get that kind of leather elephant type skin. And then skin and soft tissue changes, like the swelling that occurs, your skin's going to change and it will not go back. As far as treatment, the main thing that you will do is look to increase your activity. If you can exercise, that will help. Physical therapy, occupational therapy will help, because that's one of the things that you'll see as far as the sign and symptoms is you'll have a decreased range of motion and lack of movement because of the swelling. Elevating the area will help, as well as compression stockings, compression dressings, or compression devices. Those are really good. And you also want to stay away from heat, because heat will compound it. The other thing that you can look at as far as treatment is surgery. They will do a lymphatic bypass, or a lymph node transfer can be done. They can also do debulking, where they actually take the skin and the area and remove a lot of the tissue that's involved. You want to decrease your salt intake and increase your water intake. That's a little different. But in this situation with lymphedema, it's not like regular edema. Diuretics or water pills generally do not work to help out here. So a pill like Lasix or furosemide or Bumex or bumetanide, you won't see the results that you would with just regular edema. You might see a little, but they're not going to be near as effective. The doctor may put you on antibiotics to try and take care of an infection that may be causing it, and also, of course, pain meds because you will be uncomfortable.